Would you be okay that your 16 to 18-year-old went in to try cannabis without any kind of education?
No, I would always want anyone taking any drugs to know how it's been grown, what the dosage is. I'm a longtime user. I'm an ex-hippie. I'm an old guy. And I personally feel that it's incredibly safe for me. I've never had anything negative. But if I had a young person that wasn't sure if they were or not, I'd say, you know what, be cautious.
Welcome to Look Again, Mental Illness Reexamined. I'm your host, Faydra Aldridge. Today we're going to be discussing a topic that's gaining more attention, and for good reason. Since Canada legalized cannabis use, many have embraced the freedom to consume it more openly. But here's the twist. While cannabis is often seen as a harmless way to relax, research shows that it can sometimes have a much darker side. Evidence shows a potential link between the use of THC products, the main psychoactive ingredient in cannabis, and serious health issues like chronic psychotic disorders, particularly among young men. Studies have shown that emergency room visits for cannabis-induced psychosis in Ontario have increased by a staggering 220% between 2014 and 2021. Even more alarming is that for young men aged 14 to 24, the risk of developing schizophrenia increases to over 40% within 3 years after showing up in an emergency room for cannabis-induced psychosis. Today, we're exploring the reality of cannabis-induced psychosis, and to help us better understand the scientific side of this issue, I'm joined by Dr. André McDonald, an epidemiologist and lead author of a groundbreaking recent study called Age-Dependent Association of Cannabis Use with Risk of Psychotic Disorder. Dr. McDonald, thank you so much for joining us here today.
Thank you very much for having me.
Okay, so let's dive in. Dr. McDonald, I'd love to hear you talk about the highlights of your study and maybe some things that surprised you.
The main finding was that teens who use cannabis were 11 times more likely to develop a psychotic disorder compared to teens who didn't use cannabis. This number increased when we made it more specific to hospitalizations and ED visits. So it was 27 times higher risk for teens using cannabis compared to those not using cannabis. What was surprising was we didn't find a significant association in young adulthood. The fact that it was specific to the teenage years, we weren't expecting to find. We would have expected at least some association in young adulthood, but we didn't. And we would want to see more studies that kind of confirm this, but yeah, definitely that was a surprising finding.
So your study that was recently published found that teens who use cannabis are 11 times more likely to be at risk of developing a psychotic disorder. 11 times. So could you just explain the importance of this finding and how it compares to previous research on cannabis use and mental health?
Yeah, so it was quite a striking number. Most previous research, there have been some meta-analyses which basically just pools all of the studies that have previously been done. And those have suggested that the association between cannabis use and psychotic disorders was about double for those who used cannabis versus those who didn't. So 11 is a lot higher. Some of the possible reasons are that we use more recent cannabis use data, and cannabis has increased in potency quite dramatically over the last couple decades. The other possible reason is that in this study, we separated out the association for teens, so from age 12 to 20 versus those 20 and over. So we found the strong association in the teenage years, and we didn't find a significant association in young adulthood.
And how long did your study last?
It started in 2009 to 2012. Those were the years that the survey was done. And then we followed everyone for up to 9 years. So 6 to 9 years, which is quite a long follow-up.
So why do you think the effects are so pronounced in teenagers, but not in young adults?
Previous research looking at neurodevelopment suggests that adolescents' brains are developing at a very fast pace. And so if you're exposing that brain to THC, that can affect it in a much stronger way than when the brain is more developed and sort of has reached maturity in young adulthood.
And you talked about this earlier. I'd like to talk and dive in a little bit deeper around the strength of THC. And with the potency of THC increasing over the years, what does your research show is the connection between the increasing strength of cannabis products and the increased risk of psychotic disorders for adolescents?
So it's difficult to pinpoint. We don't have solid data on exactly what the average THC potency was every year. We have rough estimates. So some of the estimates in the 80s, it was about 3% on average for flower cannabis. Today, in the post-legalization world, it's over 20% for flower products. And that's not to mention concentrates, which can get up into the 90% range. So it's fundamentally different products that we have today compared to a couple of decades ago.
In your study, I read that you couldn't fully rule out reverse causation, which means that some teens may have been self-medicating with cannabis before their diagnosis. So could you just elaborate on how this affects or perhaps even complicates the interpretation of your findings?
Yeah, it's one of the biggest limitations of all of these kinds of studies. So in order to basically rule out reverse causation, you would have to randomize to teens, basically tell half of a sample to use cannabis and the other half to not use cannabis and see which group developed psychotic disorders at a higher rate. That's not ethical. We can't do that. So the best that we can do is observational studies like this one, where we basically ask teens, are you using cannabis? And then follow them over time to see if they developed a psychotic disorder. In this case, we used medical records, basically when a physician diagnosed the teen or the young adult with a psychotic disorder. Reverse causation is very difficult to eliminate entirely. In this study, we tried to do that by excluding any teens and young adults who had a psychotic disorder diagnosis prior to us asking them about their cannabis use. But that doesn't entirely eliminate reverse causation. It's still possible that they had symptoms before they were diagnosed with a psychotic disorder, and cannabis came after those symptoms. So we can't, with these data, we can't answer that question perfectly.
Yeah, makes sense. How many participants were in your study, Dr. McDonald?
Just over 11,000.
A lot of people.
Yeah, it's one of the largest studies on this topic, certainly among youth.
That's great. So in your paper, Dr. McDonald, you highlighted that most teens who develop a psychotic disorder had a history of cannabis use, and yet the majority of cannabis using teens won't go on to develop psychosis.
Right.
So I'm curious around the factors that might play a role in determining who is most vulnerable based on this fact.
So psychotic disorders are a very rare event. And because of that, the vast majority of people won't have them. So both in cannabis users, teens, and non-cannabis users, it's very unlikely that they will develop a psychotic disorder. But this study is suggesting that in the teens who did use cannabis, it's a very, very high proportion. So the real determining factors that this study is suggesting is a younger age. So if you use cannabis in your teenage years, that is really a strong predictor of whether you're going to develop a psychotic disorder. But it is important to acknowledge, and I'm kind of rehashing this, but most teens who use cannabis, the vast majority won't develop a psychotic disorder. It's important to place that in context because we don't want to give the wrong message that if you use cannabis, you're automatically going to get a psychotic disorder. You have to situate the risk for teens, but based on these numbers, we can make the recommendation that teens should probably avoid using cannabis until they're older.
You're listening to Look Again, Mental Illness Reexamined, brought to you by the BC Schizophrenia Society and our BC partner organizations. Thanks for tuning in to this interview with cannabis researcher Dr. André McDonald from McMaster University. And just a quick reminder, don't forget to subscribe to the podcast and leave us a review or topic suggestions. Your feedback is really important and helps us continue bringing these critical topics to the forefront. So now let's talk about the legal aspects. The Cannabis Act Legislative Review recommended several strategies to mitigate cannabis-related harms. Now, how do you see your findings influencing these policy recommendations, especially regarding the younger generation, protecting youth in terms of THC regulation?
Yeah, the legislative review recognized the importance of reducing cannabis use among youth. Canadian youth are among the heaviest users of cannabis in the world in terms of any group in the world. That was before legalization. That's still the case today. One of the primary goals of legalization was to reduce use among youth, and it hasn't had that impact. And so the legislative review recognized that, put forth several recommendations for how government might influence that. So I think this study just adds to the urgency that government should have in addressing this, because we haven't figured it out, and it's really important that we do.
Yeah, important to get that message out there.
Mm-hmm.
Based on your research, what role do you think that schools, healthcare providers, parents, caregivers should be playing in preventing early cannabis use, especially given its legalization as well as its increased social acceptance?
Yeah, I think it's all around awareness. I think a lot of people aren't aware of this. I mentioned earlier that cannabis potency has increased a lot, but teens who were growing up with cannabis where it was relatively low THC might not see it as a dangerous product, but their kids today are using a different product. And so we really need to spread that awareness that these products are more harmful, and that schools, parents, everyone has to work together to really get this message out. And teens need to get this message.
Yeah. And one thing that I found really interesting about your study was that it followed individuals into young adulthood and found that the risk of cannabis-induced psychosis seems to decline after adolescence. So I'm curious, what is that about? And do you think that there's potentially a safe or a safer age to use cannabis without having that increased risk of psychosis?
So this study suggests that it's over 20 years of age. That's when we didn't find an association between cannabis use and psychotic disorders. And just to clarify, so this study looked at the onset of chronic psychotic illness. So this study alone can't suggest that if you're in your young adulthood years, so like in your early 20s, that it's safe to use cannabis. We can be confident in saying that in teenage years, there is this really strong association. So in terms of public health messaging coming from this, what we're really saying is if you can delay your cannabis use until 20 years of age or older, preferably until you're 30 even, that would probably be ideal. But this is one study. We would want to see more studies to really become more precise with that estimate.
And sticking to the research conversation, what further research do you think we need at this point just to fully understand the relationship between cannabis use and psychosis, particularly in light of increasing legalization and the changing cannabis products on the market?
We need more recent studies. A lot of our understanding of this relationship is based on studies from the 20th century. So my study was using data from the past decade. We need more studies like that. I think we need larger sample sizes in terms of getting a more precise estimate of what the risk actually is. So we were estimating that it's about 11 times higher among teens who use cannabis compared to teens who don't use cannabis. But the lower limit of that estimate was, I think, about 5. And so you would want teens to know what the actual risk is of using cannabis so that they can make informed decisions.
And another point that I wanted to talk about, this one I find absolutely staggering. 220% between the years of 2014 and 2021. Studies have shown that emergency room visits for cannabis-induced psychosis in Ontario. I'd love to hear your thoughts on that.
Public health-wise, that's not a good development coming from legalization. When they were thinking up legalization, they were not hoping that that would happen. I think government needs to take a step back and really think about those kinds of things that are happening with legalization. Not only cannabis-induced psychosis, there have been increased cannabis poisonings among youth and elderly. The prevalence of cannabis use has increased, especially among adults. Fortunately, it seems like teens it hasn't increased, but again, one of the goals of legalization was to reduce cannabis use, so that hasn't happened. But yeah, there's a lot of negative impacts that legalization has had on cannabis and cannabis-related harms.
Yeah, there's a lot to think about there. If someone is listening right now with a teenager in their life, what advice would you give them when it comes to talking about using cannabis?
It's a tricky conversation. People have been having these conversations forever, basically telling their kids that they should say no to drugs. But cannabis specifically, I think it's more urgent that the message gets across that these products are harmful. In previous decades, it maybe wasn't as harmful. And so I think the message has to be stronger in tandem with that increasing potency of cannabis, basically telling youth, if you can delay your cannabis use until you're in your young adult years, that can only be a good thing.
My experience with young people is everybody has to try things that their parents reject or that our people are afraid of. It's your job to rebel. And frankly, I think smoking cannabis or eating cannabis is much safer than alcohol. We know that cannabis, when you're driving under the influence, you have almost no problems driving compared to alcohol, 1 drink or 2 drinks, and you could be a danger and kill people.
Yeah, that is not an uncommon belief. It's something we consistently hear, that cannabis is a natural product and it's safer than alcohol. But I'd love to hear your thoughts on that.
Yeah, I think in the teenage years, there's an argument to be made that cannabis is quite harmful. As an adult, when your brain is fully matured, alcohol is having a much larger public health impact than cannabis, primarily because more people drink alcohol than use cannabis. And driving under the influence of alcohol is more harmful than driving under the influence of cannabis. Not to say that driving under the influence of cannabis is not harmful, but the relative impact is larger. There's just so much more research on the harms of alcohol compared to cannabis that it's difficult to say with certainty that it is more harmful. I would want to see more comparative research, but based on the evidence right now, alcohol probably is having a larger impact than cannabis.
I have another question around the legalization. Based on your study and everything that you just said about the legalization, what impact do you think your study could potentially have on influencing government, on influencing policy as we move forward?
I think it's just adding to the urgency of this. This study is suggesting that the association is stronger than we previously thought. And based on that, government should be taking this more seriously. We haven't found an effective way of reducing cannabis use among teens. And so that has to be a really high priority for all levels of government.
Thank you. And one final question. What advice would you give a young person right now who is debating trying cannabis for the very first time?
I would say that based on the scientific evidence, they should wait until they're older. This study is suggesting that there's a really strong association between cannabis use and psychotic disorders in the teenage years. So if they can wait until they're older, protect your brain. That would be my recommendation.
Thank you. Dr. McDonald, thank you so much for sharing your expertise with us today. The work you're doing is incredibly valuable in helping to understand the risks associated with cannabis use, especially for our youth. You've given us a lot to think about, including around the legalization of cannabis. So thank you.
Thank you for having me. This was great.
And to you, our audience, thanks for joining us. We are going to be including a link to Dr. McDonald's study and some of the other related resources in our show notes, so be sure to check those out. And if you have any questions, suggestions for topics, or just general comments, please do not hesitate to reach out to us on social media. We really do want to hear from you at BC Schizophrenia or at BCSS Youth. And to get our latest episodes, just hit follow on Apple Podcasts, Spotify, or anywhere you listen to podcasts. We are going to be back soon with more thought-provoking discussions about mental illness in our next episode. Talk to you soon.
This podcast is brought to you by the BC Schizophrenia Society and the BC Partners for Mental Health and Substance Use Information. We're a group of nonprofit agencies providing good quality mental health literacy resources to help individuals and families maintain or improve their mental well-being. The BC Partners members are Anxiety Canada, BC Schizophrenia Society, Canadian Institute for Substance Use Research, Canadian Mental Health Association's BC Division, Family Smart, Embody, the North Shore Family Services Program, and Mood Disorders Association of BC, a branch of Lookout Housing and Health Society. The BC Partners are funded and stewarded by BC Mental Health and Substance Use Services, an agency of the Provincial Health Services Authority.